Welcome to Alpine Learning Group's Innovations in Autism webinar series. Alpine Learning Group offers a full range of diagnostic and applied behavior analysis-based educational and clinical services to individuals of all ages. Each year, during Autism Acceptance Month, we share our expertise through free webinars and make them available to the community. At the close of this presentation, we will share a link to learn about other presentations in this series. I'm Dr. Jamie DeQuinzio, psychologist and behavior analyst here at Alpine Learning Group, and I am thrilled to introduce our presenter today, Dr. Kate Fiske. She is the founder and director of North Star Family Autism Center, which provides psychotherapy and support to individuals with autism and their families. She's a licensed psychologist and board-certified behavior analyst and completed her doctorate in clinical psychology at Rutgers University, New Brunswick. She has worked in the field of autism treatment for over 25 years. That's amazing. Providing evidence-based services in skill acquisition and behavior reduction in inpatient, outpatient, and school settings. She's authored numerous chapters and journal articles on the treatment of children with autism and their families, and she's the author of the book, Autism and the Family, Understanding and Supporting Parents and Siblings. And we're thrilled, like I said, to have her here today, sharing some valuable information for family members of individuals with autism. So with that, Dr. Kate Fiske.
Thanks so much, Jamie. I'm really glad to be here today. Thanks to Alpine for having me. I'm glad to be part of your autism acceptance event and really appreciate the work that you put into getting information like this out to families and sharing these resources. So today, jumping in, I'm going to be talking about family wellness in the care of individuals with autism. So we see, as Jamie mentioned, at our practice, North Star Family Autism Center, we see the whole range of the autism spectrum. We see really young children with autism. We see adolescents, we see adults, but the reason that we formed our center in the first place was to provide support to the entire family. And I'll talk a little bit about what that looks like as I go through, just naturally, as I refer to and pull from some of the work that we've done to illustrate my talk. But I think it is in our work, what we're really trying to do is center the individual with autism, but then also make sure that we are providing support to siblings, to parents, to the whole family system. So that we can improve family wellness overall. So one thing that I want to do before I jump into what I have to say, I'm not sure how many of you attended the parent panel that was offered last week as part of this same series. Commonly for our families, when I'm doing presentations like this, what I will do is I will offer a parent panel at the same time that I'm doing a presentation because I think that they are so wonderfully informative and illustrative. And for a lot of professionals, who are working in the field, sometimes they haven't had the time and the opportunity to speak with families about their experiences. So I really want to thank Lucille, Suzette, Mark for sharing their experiences last week. And I actually will refer to that panel a couple times in the presentation today, because again, I think it is so informative and what those parents shared really ties into what I have to talk about today. So what I will say is that Bridget Taylor did a wonderful job last week facilitating that conversation and talking on a lot of the points that I commonly will bring up, which is drawn largely from the research. So there's kind of what I pull from the research, and then there's also what I pull from in terms of the experience that I do in our daily work. I'm going to provide a brief overview of what we know about parents' experiences and families' experiences generally from the research, just to provide that background for those who were not able to attend the parent panel last week. And what I think, some of the biggest take-home points related to family experiences is that what we see is that for parents of caregivers of children, adolescents, adults with autism, we see greater levels of stress among these parents than we do among virtually any other parenting group. So when we're looking at comparisons with parents of neurotypical children, parents of children who have a chronic illness, we see that higher level of stress. And it can be tied to, and I'll talk about these in a few moments, there's a number of variables that it's tied to that can predict the level of stress that a parent might experience. So at the top of the list, we see things like social support that can predict parent stress, or challenging behavior in the home can predict parent stress. There's a number of variables, and again, I'll get to those, but we certainly see this higher level of stress for parents. Um, and that level of stress can then also be related to higher experiences of anxiety and depression for parents at home, which is really meaningful, right? It's meaningful for parents, it's meaningful for clinicians to really recognize the impact that that level of stress can have on parent wellness and their ability to really integrate and collaborate on the treatment for their child. And there's a whole collection of really complex emotions that can come up around raising a child with autism. And we see kind of these predictable and then sometimes unpredictable surges in these emotions. And I refer to Lucille from the panel last week, who mentioned that when you are parenting a child with autism and you get that diagnosis of autism, for a lot of parents, what Lucille said, she said, your heart is broken from day one. And I think that for what's really helpful for clinicians in particular to really recognize is that for some parents at that time of diagnosis, there is considerable grief that parents experience. And I think all of the parents were talking about kind of these ideas that they have for their child, and what they think that their child might be able to accomplish in their lives. And when a child is diagnosed with autism, that suddenly becomes much less predictable. And there's a lot more uncertainty that is introduced. And so parents might experience grief about that. Lucille also mentioned, like, she will wonder throughout her child's development, her son is now an adult, what he could have been like, what he would have been like if he didn't have a diagnosis of autism. I will pause for a moment, and I'm going to talk about this in a few slides. There can be kind of this challenge that comes up between individuals who are diagnosed with autism and really identify with their autism diagnosis, and everything that comes along with it, and a lot of pride in kind of what they are capable of. And then that can be when it's juxtaposed with parents who are struggling with moving through the various emotions that they experience related to their child's diagnosis, that can be a challenge. And so again, I can talk about that in a few moments, but I just want to make sure that I recognize kind of how difficult that can be in the context of a family system. Other feelings that might come up related to guilt, anger, joy in raising their child. Again, these are really complex emotions, and lots of them can happen at the same time. Suzette, I believe, from the panel was talking about these surges that happen in these emotions around things where there's kind of this comparison with where their child might have been, right? So she mentioned graduation, prom, when other kids are getting their license, right? And her child has not been able to accomplish those same things and won't accomplish those same things. I work with a family closely, and graduation in particular, high school graduations, college graduations can really catch her off guard in terms of the stress that she experiences and the grief that she has about where her children are in relation to these peers, even though they may graduate and have graduated, kind of what the future looks like for them and how easy or difficult it is for them can be very difficult. And these same emotions can also, create really unpredictable surges in this. And I've got a number of families that I work with where it's, kind of these moments that happen in any given day that can suddenly bring up again these feelings that can be difficult to grapple with. And again, it's really helpful for professionals to recognize that can happen I have a parent that I've worked with for a very long time. She was participated in a lot of the panels that I have done, and she talks about this one experience of driving down the street with her son and seeing a group of boys playing football in the front yard of a house, and suddenly just being hit with the realization that her son would never be like those kids, and the grief hitting her in that moment. And that's one of those unpredictable surges, right? And I think that for clinicians, it can be really helpful to recognize that those happen in any given day, and to really have grace for parents when they might be emotional or upset about things, and you have kind of no idea what might be behind some of that in those moments. So, touching briefly on siblings, with parents, there is a bit of a shared experience. Having pulled a lot of parent panels together, parents can really share and connect about their experiences. And while their experiences may differ from family to family, there are still kind of these shared emotions that a lot of parents will talk about. Siblings, I will say, based on my own experience, are a bit less predictable in terms of their how they respond to the experiences they have. And I think that, part of that is that there are so many different variables that can impact a sibling's outcome, right? So part of it is the sibling themselves, part of it is who their brother or sister is, and also part of it is how their parents adapt, and kind of how their parents model, certain behavior or coping at home. All of those things can certainly impact the siblings. But we do hear from siblings these shared experiences, which can be things related to certain emotions, such as frustration or jealousy. I think that there is not a parent that I've talked to who doesn't kind of talk about their children, their child who does not have autism, experiencing some of those emotions. And when I talk to adult siblings, they are definitely able to reflect on having those feelings, but also able to talk about, especially in adulthood, the pride that they have for their brother or sister, related to everything that they've been able to accomplish in their lives, recognizing kind of the challenges and the hurdles that their brother or sister faces, and watching the ability for them to make those shifts. So, that generally, again, that's very like bird's eye view globally, speaking to the parent experience or the sibling experience. And, to kind of summarize what we know about research is that generally speaking, if I have a family that comes into my practice, I can expect that their stress level is going to be higher and that there are going to be a lot of complicated emotions for all of the family members. But what I can expect is, what the primary emotions are going to be in any given moment. That can shift considerably. And I've had parents who will participate in panels from year to year, and every year is different based on where their child is and where they are with their coping. So that can, it can be very difficult to really predict what a family in any given moment, any given day is going to be bringing to us. And part of that, I think, is because when we talk about the work that we do, like I said, we're serving the entire spectrum. And so the profiles of the learners that we have, and therefore the parents that are caring for them, are very different. And so to kind of give you an illustration, um, I'm going to talk about two different profiles, and these are not specific kids, but give you an idea of the type of um, autistic individuals that we might see, and what some of the concerns might be, right? And so if we think about one child who comes in who is significantly impacted by her autism diagnosis, might fall in kind of that profound autism category, primarily non-vocal, non-verbal, so communicating, but maybe through other means, right? So maybe there's an augmentative communication system in place, but also it's possible that there's higher levels of challenging behavior in this situation as she's working and struggling to communicate. This might be a learner who requires considerable care, 24/7 care. Parents who really talk about their child. If their child is up at night, parents are up at night. And so in this case, having effects on kind of parent, cycles and again, well-being. And we'll talk about how those variables can impact. But that's, again, this isn't one specific child, but, it's an idea profile of a type of learner that we might see, and provide support for them, but for their family members. Okay. But then we might have another learner or another, individual who's coming to us who maybe is a teen who was diagnosed with autism maybe a little bit later, maybe in late childhood, early adolescence. Still families working through kind of what autism means. Uh, Communicates very well, but may still have difficulty communicating emotions, which can be challenging because there can be difficulties with emotion regulation that come up, challenges with executive functioning. So this might be a kid who's in general education setting, headed for college, but is really struggling to complete the work that needs to get done or work on long-term projects and think about kind of what comes next in terms of college. And this also might be a kid who struggles with really connecting with peers or maintaining those friendships over time. So the profiles look very different. We're talking about the same diagnosis, but how, the support that we provide and the support that parents need is going to differ slightly. However, what I will say, and this is where I'll move to kind of looking at what are the variables that are in play for parents and what is it that we need to address. I took a few moments to think about kind of what is the overlap between these two groups, right? So while these two profiles are different in terms of how these children present, when I think about what it is the family support needs are, a lot of the family support needs fall in the middle still. And so I'm going to talk through these a bit in terms of what it is that we see for families. And then after I go through these, I'll talk through what it is that clinicians are able to provide or families can seek out in terms of the support that they might need. So, what we see across the board for a lot of families, and I referenced this already, is this idea of tolerating uncertainty, right? The idea, Mark talked about this in the parent panel last week, is just the uncertainty of what comes next for a child. And again, whether that means, are they going to require continued care into their adult life? Or is this maybe they're able to move into, like I said, a college setting or a vocational setting, but what kind of support are they going to need there? Are they going to be able to live on their own? A lot of parents being forced to think much further into the future than parents might do on a regular basis. And there's a lot of uncertainty in those spaces that we have to consider that can be really challenging for parents. And I always tell parents, like, there are human beings do not do well with uncertainty just in general. We don't like uncertainty. We prefer for things to be certain and predictable. It creates, just general distress. And I remember during the COVID pandemic, how uncertain that time felt for the entire world. And I'm sure everybody remembers the high level of stress that you experienced during that period. And I did hear from parents of autistic children, it's like, that is what we experience every day, is uncertainty like that and not knowing what the future is going to bring. So that is a variable, again, across the board that we really see for parents. I referenced this earlier. Social connections are a big piece of, we know it's one of the biggest predictors for parent stress is not necessarily how much social support they have, but how much perceived social support they have. So how much they feel like if they need it, somebody has their back, somebody's there for them. And we know that for parents of, children, adolescents, adults with autism, the social support and their social connections, it's lower than we see for other parents. And so that is a considerable stressor. And we'll talk about that in a few moments. That can contribute, again, regardless of the profile for families, because it's about, are you able to connect with other people who understand your experiences? The other piece of this is grappling with the social connections for your child. How do you help your child connect with other people as well? and trying to help facilitate that. So social connections across the board, whether we're talking about the individual, whether we're talking about the family, that can be something that comes up. And certainly we see that with siblings as well. And again, I'll talk about that in a few moments in terms of how we might be able to address that. I reference this already in terms of thinking about both of those separate profiles, but we see emotional dysregulation for individuals on the autism spectrum across the spectrum. So certainly when we have a child who has difficulty communicating and has limited language, that child is going to have potentially a greater level of challenging behavior because they're looking for ways of communicating, right? Um, but when we're talking about children, teens, adults who are diagnosed with autism and may have communicative ability, we still see, and research shows that there's a higher level of emotional dysregulation for those individuals. And a lot of times when we're talking about a practice like ours, that's why individuals are finding us in the first place, is because they are working through a lot of challenges with anxiety, anger, outbursts. They'll refer to them as meltdowns or shutdowns, is just difficulty kind of dealing with the day to day. And so that is certainly something the individual experiences. And then because there's so much support that's often provided by family, families are also grappling with that emotional dysregulation and trying to figure out how best to support. So that's something that we see in that space as well. Building communication, it comes from that, right? So emotional regulation will require some of those communication skills to be built in terms of communicating wants and needs, communicating more abstract emotional experiences that an individual may be experiencing, but then also building communication across the family. And I'll get to that. Flexibility is a key piece. This certainly comes into play. We know this for individuals with autism, right? So we tend to see more rigid or ritualistic behavior for autistic individuals. And, certainly maybe some of that insistence on sameness or having really specific thoughts and beliefs about the world or about the people in their world that can be challenging to shift. And so that is something that we have to work on, but also working with families on their own flexibility, given who their child is, maybe who the siblings are. How do they work around what is coming up with their child? How can they be flexible? And we'll talk through that. Co-parenting, sibling relationships, all of those family pieces. We know from research that we do see higher levels of conflict among parents who have an autistic child. Not a huge surprise given the fact that when you're raising a child on the spectrum, there are so many decisions to be made, and so many things that can come up on a daily basis that it can be harder for parents to be on the same page all of the time. And as a result, there is kind of that higher level of conflict, and helping families work through that will be important. Building sibling relationships, siblings to siblings, but also relationships with parents. And then also talking about the idea of finding purpose for a family, for a child. That came up in the panel last week, and I thought it was such a wonderful point, is families really trying to kind of move towards what is purposeful for their child, right? Where can the whole family find meaning and value and joy, and moving towards those spaces. So again, when I think about these two profiles and the overlap in terms of the support for the family, there's so much that's falling in that middle ground. And so we can really imagine that a lot of this is support that we might have to be providing based on what we see for a specific family. And we do some assessment ahead of time to look and see kind of where are they, what is their social support system and what is the emotional regulation piece? How are they doing as parents together, looking at all of those pieces. In terms of the profiles separately, it actually was a bit challenging for me to kind of think about how these two groups might differ. So When we're talking about children who might be profoundly impacted by their autism diagnosis, I do think that in these cases, we might expect more physical impact of caring for this child, especially in this, certainly is not across the board, right? But if you have a child who has higher levels of challenging behavior, there's a lot of physical care that goes into a child like that, or physical care helping them with daily tasks like showering and bathing. Um, there might also be a physical impact of things like I talked about, a child who needs constant supervision. And so it's harder for parents to find the downtime that they need, even just sleep overnight. And so experiencing some of that physical impact day to day. Um, and a potential, again, this is going to vary from family to family because everybody's support network is a little bit different, but there's a potential for greater social isolation, again, maybe related to how easily able to integrate their child into their community. So whether it's in their religious community or whether it's in their neighborhood, whether it's in the school, how much can their child be integrated, and therefore how much is the family connected in that space? And then I think about when we talk about um, maybe teens, adults, especially with newer diagnoses, a lot of the work that we have to do in that space is helping parents build greater understanding of what it is that their child is experiencing, especially because they have a child who may have considerable skills in a lot of different areas. And it can be difficult for a parent to wrap their head around the places where their teen or their adult child is getting stuck. And so being able to build that understanding so that parents can approach that relationship with greater sense of empathy, compassion for what it is that their child is experiencing, and vice versa. I will say that that sometimes it's difficult for teens to, and this is just in general, for teens to take perspective of their parents, and so helping teens with that, especially when perspective taking can be challenging just by virtue of the diagnosis, helping teens do that is something that is part of this puzzle too. And again, that can come up when we talk about parents who are experiencing significantly complex relationship or emotions, and teens or adults who don't understand or actually might become very frustrated and upset about the parent's expression of those emotions. And so trying to get that understanding and empathy go both ways. Okay, so that's kind of like how I conceptualize as a family comes in. We're thinking about all of these different pieces. What is the type of support that might be provided? What can we imagine some of those areas might be? And what are the unique areas that we might have to consider for a specific family? Okay. So I want to talk through, the different prongs of approach that clinicians can use, and then certainly that parents can seek out in terms of the support that they might need in caring for their child and caring for themselves. Those things are going to be really important. And I want to start with education. And this goes for any family that we work with that comes in, or any setting, right? Whether you're working in a school, whether you're working in an ABA agency, um, is making sure that you're including parent education as part of the work that we do, to build both knowledge about their child and compassion. Just in reference to what I just talked about, knowledge is really important because we know from research that the greater sense of self-efficacy that a parent has, the greater sense that they have that they know what's going on and they know how to address a specific challenge, the less stress that they're going to experience. And education is one part of it. Certainly with self-efficacy, there's other pieces too that we'll get to, but knowledge is kind of the first pass. And knowledge will also help build compassion. Again, knowledge about autism, just in terms of building up that understanding and empathy. So you can see a few bullets here in terms of what knowledge and education might look like family to family. So for any family, I think it's really helpful to talk about autism, the diagnosis, and how it affects their child. whether their child is really young and just received that diagnosis potentially, or whether their child is a teenager, again, may have just received the diagnosis, but maybe their child has been diagnosed for a while and they're still grappling with what that means for their child in this current phase of life. And certainly for adults as well, that can be something that can come up. And we have seen an enormous shift, and I certainly have as a clinician, in terms of the diagnostic work that we're doing with older adolescents, young adults, and older adults in terms of seeking out a diagnosis and a way of kind of better understanding and getting the support that they need for themselves as they work to kind of advocate for their own self-care. And so we certainly will come across parents, siblings who are learning about a diagnosis for the very first time as their child is in their 20s, 30s, 40s. We're providing diagnoses at those points. And so that education is going to be really important for parents in terms of really understanding how, especially because the spectrum is so broad. When we look at the diagnostic criteria, there's so many things that can fall into these two areas of diagnosis, right? Social communication, restricted and repetitive behavior. But what falls in those areas is an enormous constellation of behavior. And so what does this mean for this specific individual, and how can we help build that understanding for parents? Also, when we're talking about children who are coming to us who have other concerns, so yes, autism, but maybe they're also experiencing anxiety. Maybe there's significant avoidance of specific events or places or people or experiences. They're avoiding those. Maybe there's challenging behavior, right? So it might be something like disruptive behavior at home or at school, aggressions, maybe self-injury. Certainly, because it's part of the diagnosis, restricted and repetitive behavior can take all forms. And some forms we've worked really hard to really recognize and respect how regulating restricted and repetitive behavior can be for some individuals, and helping individuals find time and space for those, and helping parents and family members understand the need for those, but then also recognizing that in some cases, some of them can be disruptive, and how do we work to kind of problem solve that with family members. So these are all things that might come up in the context of our work, and building knowledge for family members about why this behavior happens. And we do this across the board. So there are a lot of behavior analysts who might be doing work in the context of acceptance and commitment therapy, for example, for individuals who don't have autism but have significant anxiety, right? And the premise in that is looking at, why is this behavior working for somebody, right? And that is always the question. It's basic, and if you're familiar with the use of ABA, individuals with autism, right? It's the idea of what's the function of the behavior, but we look at it as, what is this? Why is this behavior working? Why is it still here? And really kind of trying to suss that out and educate parents about what it is that might be going on at home that might be maintaining that behavior. The Ruby program is really helpful for a lot of parents in terms of building up that education, especially in those earlier years when their child is young and maybe there's challenging behavior. But we certainly pull from a lot of other areas as well to help build education about, again, why does the behavior work, and what are some changes that we might be able to make to help move forward. And I talked about this a bit, but normalizing not only the experiences of autistic individuals, but also normalizing the experiences of different developmental phases, right? So we talk about this frequently in the teenage years, that sometimes parents will, talk about the stressors that they're experiencing at home. And we kind of have to kind of balance out what it is that the parents are experiencing that might be related to an autism diagnosis, and what it is that the parents are experiencing in terms of maybe conflict that's going on because they have a teenager. And that is what many parents are experiencing at that time. There's still really helpful strategies and approaches that can be used, but really trying to normalize that period for parents can be very helpful. Same can be said for kind of the really early ages in terms of development, and certainly adults as well. And really kind of conveying sometimes to parents, again, from that place of like empathy, compassion, as we're building up this knowledge about what autism is and what it means for their child, is really helping them see that sometimes it really is this hard, right? Because it can be difficult sometimes for caregivers to understand, again, if they can do these things, why can't they do these, right? And especially for those of us who don't have a diagnosis of autism, it can be really hard to understand, when things seem so simple and straightforward for us, why it's so challenging for a child, right? And so really helping build that message that sometimes for some kids, it really is this hard. And coming at from that place can help decrease tensions across the board for the entire family. Another piece is building up coping skills, again, for all family members. And this is to create space for what comes next. So we want to be able to move to problem solving, but we need to be able to cope with our emotions first. And this goes for autistic individuals and it goes for their family members as well. Um, a big thing that we all have to work on is awareness of the body cues of when things feel like they're getting really big. And I think I say that phrase to parents just as much as I say to the individuals with autism that we work with, is that getting a sense of when your emotions are getting big or what those initial cues are, that you're headed to a space that you have more difficulty coping with, is going to be really important. I know, as a parent, I can sense certain changes that happen in my body when things start to get more tense, right? And those are the moments to say, okay, if I'm going to move forward in terms of problem solving, I've got to be able to kind of slow this down. There are a lot of strategies that we work on that yes, it works here, but we work on these same strategies across professions, right? So we teach doctors how to kind of, calm themselves using deep breaths before they go into a room to meet with a patient. And the research indicates that they're better at their job when they do that. Right. And the same could be expected for parents. The same could be expected for teens, is that if we're taking those moments to slow ourselves down, it can be beneficial. Breathing is here. Breathing kind of gets a bad rap sometimes because people are always like, it doesn't work. Breathing doesn't work. And I think it's really important to figure out the breathing strategy that works for you to slow it down. Like whether it's a visualization strategy that can be really helpful, whether it's a certain counting length that can be helpful. There are lots of different breathing strategies that can be used. There are some that for me make me hyperventilate, and there are others that are really calming. It's about finding the one that works for you in terms of helping slow you down. Um, Grounding is the ability to really kind of like localize yourself, focus on where you are, focus on placing your feet on the floor, feeling the weight of your feet on the floor, feeling your body in your chair, and really noticing kind of what's going on in your body, grounding yourself in the moment. And along with that comes present moment awareness. And I would say, mindfulness is another way of saying this. Again, mindfulness is another term that sometimes people will be very dismissive of very quickly because we hear so much about it. But present moment awareness, I use because it can be so quick. And I think sometimes parents are like, I don't have time to be mindful. Things are moving too fast. Present moment awareness can be done actually in a few moments, if not even a few seconds. One of my favorite strategies that I talk about with parents is getting them to focus on what is going on in their environment. So closing their eyes and being able to stop and listen to the sounds that they hear right now. Because sometimes your mind is time traveling forwards and backwards and all over the place, and it's hard to get yourself to focus on what needs to come next. And that present moment awareness will bring you back, right, to this moment. What can you see? What can you feel? What can you hear? And really noticing those things. And then that creates space to think about these values. And that's another big piece. So coping is for us kind of that combination of the physical aspect of coping, but then also orienting yourselves to the values. One of the questions that we talk about very often is what is important in this moment? And for parents, what kind of parent do I want to be in this moment? And again, as a parent, I have to, when I feel temperatures rising, I have to stop and remind myself of, the parent that I want to be. It's like, my mantra, it's where, be patient, be kind, be patient, be kind, and slow myself down and focus on that in that moment to help me move into that next space. And always thinking about what are we moving towards? What is in anything that we're doing? If we're talking about, family vacation, why is that important to our family? If we're thinking about kind of what's going on for a child at school, what are the big values that we're moving towards? What's important for this child? And really orienting yourself there as we think about kind of the problem solving and what comes next. So that is, often where we have to spend a good amount of time is problem solving specifically to build flexibility for everybody involved. I note here that education about autism and specifically the challenges that are coming up and why those things are working, that education is really important before you move into problem solving, but so are definitely the parent coping strategies, and certainly the child strategies can be really useful too, because it's really difficult to move into a problem solving stage when tempers are flared. And very often, I will say, if we're up here, if everybody is so escalated, there's no problem solving that can happen at this moment, right? We've got to wait till everybody comes back down and is in a space where we can think about what comes next. And it might not have solved the problem in that moment, but it does allow us to think to the next thing, right? And when that happens again, what can we do differently? And that can be, I know, frustrating sometimes in the moment for parents, but I do like to take that time to think about, what are some things that we might be able to shift, taking into account all involved. So this might be parents, it might be the autistic child, teen, adult. It can be siblings. It can be grandparents or extended family members who are in the house. How is everybody tying into this problem solving? And the people who are going to be involved in solving this problem should have a seat at the table in terms of having this conversation. Um, I often encourage families to think outside the box. Uh, Families have um, kind of their go-to patterns, right? We all create patterns of predictability, and it can be difficult to shift away from things that you've always done a certain way. Um, and so thinking outside the box, coming up with new ideas can be helpful. This is where clinicians can actually, or even a friend can be a great sounding board, because sometimes they might come up with ideas that you would not have thought of. Um, and when I'm problem solving with a family, sometimes I will throw out kind of the what seem like the silliest ideas to families. And not because I think that they'll be successful, but because it gets them thinking about things that maybe are not what comes to mind immediately, right? Um, a big step is brainstorming ideas for problem solving before family members start judging and dismissing them. And this can be a challenge for partners, so parents to do together, certainly siblings and parents, autistic individuals and parents. people start shooting down ideas rather than giving everybody the space to come up with their ideas first. And I think, and I have the same challenge sometimes. It can be really challenging to not jump in with the yeah, but while you're problem solving, but giving everybody that space to come up with the strategies before we look to see what might be a viable path. And that path might involve some compromising, right? Okay, yeah, this idea works for you a little bit and it works for me a little bit. So maybe that's something that we can try, right? So compromise might be part of this. And with compromise, I think it's really important to say to everybody that anything that we choose as a potential way to solve the problem is an experiment. It's not the be all end all. As a clinician, I can't predict whether things are going to be effective or successful, but we can experiment with it. And I love to get people involved in taking data, whether it's the parents, sometimes it's the kids themselves, in terms of was this something that is successful? Was this helpful? And if it wasn't, let's go back to problem solving again. Let's go back to coming up with different ideas. But framing things as an experiment is a good way to get a little bit of buy-in for people who might be really hesitant to try something that they are not so sure is going to work. This is not a forever. This is a let's try it and see what happens. And that can be really helpful in terms of making that shift. Another big piece, and this is a little bit harder for me to talk on in the moment because every family is different in terms of the constellation of who is involved and um, what they're all bringing to the table. But certainly building communication across family members is going to be very key. We have a licensed marriage and family therapist in our practice, which is amazing because it's somebody who kind of comes at the idea of looking at the whole family system and where are things not working, right? Where are people not communicating? What's getting in the way of that communication? And how do we start to shift those patterns over time? We don't look at that as a protracted, like we've got to do this forever and ever and ever. It's about seeing whether we can make some tweaks to the family system to help improve that communication so that everybody is better able to problem solve and we see that family wellness improve over time. So all the different, constellations, we've got, two parents or caregivers communicating together, parents communicating with extended family, regardless of whether or not that extended family lives with them, but certainly if they're involved in any care of children, that is something that's going to be something that need to be focused on. Parents communicating with their child. Whether it's their autistic child, whether it is a sibling, those are relationships to focus on. Siblings to siblings is going to be a big piece. If there's conflict there, again, and this comes up very frequently at these teen years, in some places we expect conflict, but it is figuring out how to keep the temperatures a little bit lower and how can we do that. And then looking at an entire family. If it really seems like the whole family dynamic is challenging. And a lot of times what we're doing, because if we're doing this, it's commonly because there is a lot of conflict, a lot of anger, maybe sadness is in the play. And it's us looking to see, well, what's underneath the conflict? If it's we're seeing kind of these levels of anger and escalation and maybe yelling, what are kind of these softer emotions that underneath are not getting talked about? And it might be things like fear, guilt, grief, disappointment, embarrassment. Soft emotions that are completely valid, but actually really challenging to talk about in the context of a family who has different family ideas and values about autism, right? And so I think that that is a really important piece to pull into the work that we're doing with families is building that communication overall. And in addition to the communication and therefore the social support we are able to build within families, it's then also figuring out how we're connecting these families with social support outside of the home. And so that might be the clinicians. If there are clinicians, on this talk, you are a form of social support. And so how do you kind of take what it is that you are hearing about today and provide that to families, right? Kind of doing that reach out, and building like the knowledge base, building problem solving. That alone can be a form of social support. One comment I will make is that professional support in the home is incredibly beneficial. I know that there are a lot of behavior analysts, for example, that work in the home, but I think it's really integral for behavior analysts to not subscribe to the model of I work with the child in the home, and the family does their other things. And I know that there are certainly agencies that have a model of parents being pulled into the work that you're doing, but really making sure in the work that you're doing that family is incorporated in some way, especially if parents seem especially stressed about the maybe behaviors that are happening at home or challenges with communication. How do we help work on this and build it? Again, if you're a behavior analyst, within the bounds of your profession and what you feel comfortable practicing in, but making sure that we're pulling in the whole family. And then connecting families with other families where we can. It's amazing to me sometimes how siloed families can be within schools, general education schools, within agencies, out of district placements, where they're not connected with other families. They don't know other families. And so some of the work that we can do as professionals is building up opportunities for parent meetups. Those don't have to even be structured events like the next one where you're providing support or trainings for parents. It is simply a time to bring parents together for them to be able to have shared experiences. And if you're able to do it and also provide some form of childcare, that will make it very feasible, much more feasible, for parents to be able to attend. I know the logistics of that can be challenging, but I think that that is an important piece. But also keeping an eye out. I mean, you become like Facebook, social media, all these things become your friend. Keeping an eye out for events that are coming up that seem as though they are geared toward families of individuals with autism, whether it's specific organizations, right? So maybe something like Special Olympics or other organizations like that that do community events, but also one-off events, right? So maybe it's a theater doing a sensory-friendly showing, making sure that that information goes out to families so that they are able to be connected with other families. And what I hear from families is that in those spaces, there is a relief just in knowing that everybody else in the room gets it. And so I think that that's also something that's really, really beneficial about making sure that parents and families are aware of those specific opportunities. So that is quick summary of the research, but then certainly pulling into what are the different forms of support that we can provide for families given the concerns that are coming up for them at home and the concerns that are so varied across the spectrum, but still, having an idea of what it is that we can expect for parents, for siblings, in families, and the ways that we might be able to support them. So thank you again so much to Alpine for having me. I know we have a few moments for questions, and so we'll move to that at this point.
Thank you so much, Dr. Fiske, for presenting with us today. It really was a great presentation. Lots of helpful information in there for families and for clinicians as well. We do have a few minutes for questions. Nothing came up in the Q&A, but I just want to just pause briefly for a moment to see if anyone wanted to add anything to the chat in this moment. I actually had a question I wanted to bring up and a comment. I wanted to say I really appreciated, um, you know, uh, the pieces that you brought into this presentation and kind of how it was organized into coping, problem solving, communication, and social support. And I think for both families and clinicians, those are the areas that if collectively we're focusing on together in agreement. It seemed just really meaningful in terms of like just everyday things, right? Just getting through the everyday. In addition to the whole family system and the long term thinking, I was particularly struck by one of the phrases that you used, that was perhaps influenced by the stories you've heard from families, unpredictable surges.
Mm.
You know, those moments that happen to families. Would you say that would you be able to identify maybe a couple of quick tips um, for families, parents in those moments when those unpredictable surges happen?
Yeah.
What might you say?
Sure. And I think, there's two types of unpredictable surges. I think that there's the unpredictable surge, like the one that I described, where, it's just like a mom driving by a group of kids on a front yard, right? Like that is a unpredictable, like in the moment, suddenly hit by kind of what this diagnosis means in their family. Um, and then I think that there's unpredictable surges because maybe the parent was really not expecting something that was coming that as professionals we might expect, but for that parent, it kind of came out at left field. And one that I think of, and Mark alluded to this a little bit last week in the panel, is this idea that when you have your child diagnosed um, at first,
Mhm.
because the spectrum is so broad, there are a lot of parents who may say, well, if we get all the treatment in place, then we might be in a very different spot. And maybe my child will be virtually indiscriminable from other kids because that's what we see. And we see that quite often. We see that on TV, we see that in literature, like that does happen for some individuals. Um, but there is a point where some parents might be told, your child should be in an out of district placement, right? Or your child should be stay in this setting in, this classroom, an autism classroom in district, where parents are really suddenly hit with, oh, this really might be lifelong. It really is, it's going to be like this. I have some parents who they come and see me, and they come and see me in like those panic moments of like, I suddenly just got hit with this realization and I need support right now. And it is in those moments that we really do rely first off on those grounding techniques, right? Because the well of emotions that come up so high can be virtually overwhelming for parents. Um, and that's what, I've heard families talk about kind of like these like bombs that are dropped, emotional bombs that are dropped throughout their lives. And certainly we see that for some families. And so it's first grounding in in those emotions, right? How do you find your space and be able to pull yourself back when you feel like you're kind of stuck in these emotions and these thoughts? But then it is connecting with these values, right? So talking with a family about um, I suddenly realized that my child is going to need tremendous care when he's older, and I don't know who's going to care for him. And he's 5, and I can't think of what that's going to look like. Then it is saying, okay, let's figure out what the value is in this. What's so important about this right now for you? And it is maybe feeling that your child is really loved and cared for when you're not able to do it anymore. So, how do we kind of orient you right now to make sure that we're building those sorts of connections, right? That your child does have a space that they feel loved and connected, that we can start to kind of see how that's going to pull through. And so, pulling back, because very often, kind of that overwhelm is like big picture overwhelm. I'm time traveling in either direction. Pulling back to the moment and what can we do right now to move forward can be very helpful.
Yeah, thank you. That's very helpful. A couple questions came in. I think we'll have time for one more. Um, this person who wrote in is a behavior analyst, and they're struggling with implementation of family involvement. So I guess I'm wondering, do you have any tips for clinicians today who are looking to work in a compassionate way, of
Yes.
course, and are struggling a little bit with family involvement in the intervention relationship.
Yes.
That's maybe a little bit different than your focus
No, not at all. Not
today.
at all. Because I think that family wellness is a really important piece of that, right?
Mhm,
And
mhm.
and sometimes when we are not getting family involvement, it's because of everything that I talked about in terms of the stress, the overwhelm, the emotions that they're experiencing in that, and also all of the other pieces that they're trying to kind of keep afloat in a given moment. And I know that as a parent too, where it's just like sometimes like one more thing that is added in this already very stressful time feels unmanageable, right? And so I think in that space, getting some sense in terms of where parents are emotionally can be really helpful. And a very compassionate thing to do is to ask them, like, what's getting in the way of this, right? Is it that there feels like there's not enough time? Are you too overwhelmed to do this? And what are some changes that we might be able to make this something that is easier to implement? And as you know, and certainly as a behavior analyst who's working in a more community setting, I know what is kind of best practice, ABA in terms of like the whole package of everything that should be going in to address a behavior. And I also recognize that for some families, that's going to be impossible. And so, what are the pieces that I might be able to pull back and say, this is what I think is going to be the most important piece that parents can do, right? And that's what I'm going to try and make sure that we put that in place and that we can make sure that that is supported and recognize that some of these other, whether it's like something like extinction, right? That, extinction might not happen, but what can we do to offset that for certain families? What are other changes that we might be able to make that might make the effects of, not having extinction in place not such a big deal? So it also, I talked about flexibility for the individual, flexibility for the family. It becomes flexibility for the behavior analyst in terms of thinking about what is going on for this family in particular, and how can I do what I know to be good science within this specific context?
Yeah, that's really great advice in terms of flexibility. I think that that really captures it, right, for clinicians as well.
For sure.
Um, we did have one more question. I want, and we'll end with this one, Dr. Fisk. But we have a parent writing in, wondering about whether or not to move forward with a diagnosis and an evaluation for a diagnosis, as this parent is seeing some improvements in the child. Um, Certainly, this may tie into overall, um, stress, right? And the things that you talked about today in terms of the parent experience. What might you say in this situation?
So, and to make sure I understand it, it's trying to figure out whether to go ahead and get a diagnosis for their child. Okay. So, I do have thoughts on this because, and I don't know for this parent, kind of the age of the child. And I think that that does make a difference because what is improvement right now can be, it's great that there is improvement, but I also think that the effects of autism can be seen in different ways at different times, right? And so as a child improves, maybe in younger years, there might be challenges that come up later, maybe in middle school, right? Or as they move into kind of college years that create new challenges that that child might struggle with. Maybe it's social, maybe it's academic. And
Right.
having the diagnosis can be really helpful in terms of kind of having a safety net. You already have all of the information. You can decide to do with it what you will when you need to, but it's there for you so that you're not, frantically trying to get it in place when suddenly something comes up. The other piece that I think is really important is that, especially in kind of the middle school years, there is a shift in terms of teen understanding and awareness of their abilities, their social connections, and there can be frustration that comes up in that space if a child does not have a diagnosis. And there is literature, it is granted emerging literature, right, that shows that the benefits of knowing about a child's diagnosis has mental health benefits for them in those years, protective benefits, especially if the diagnosis has been given in a way that highlights what's amazing about autism, right? And so that's another piece of it as well, that parents can really kind of capture it that way, and promote what it is that we love about this kid related to their diagnosis.
Yeah, definitely. Those strength-based, focused diagnoses and recommendations are can really put a different perspective. Thank you so much. So that's all the time we have today for questions. If we can move to the next slide, I want to thank everyone for being here today. Of course, Dr. Fisk. And I just want to remind our participants that this webinar is just one in a series of webinars. Dr. Fisk referred to the one we had last week. So just so you know, we'll be conducting many of these throughout the month. We do record them and we do put them up on our website. I believe the link for the website will be added to the chat. And of course, you can go to alpinelearninggroup.org to find that as well. Finally, I just want to point out that Alpine Learning Group has a variety of services that we spoke about earlier and listed here. And we really appreciate, we're going to send a link for a survey. We appreciate your feedback, and we really want to continue to provide information that's valuable to you and your family. So all of that information hopefully has been helpful to you. And again, we're going to end now and thank you and have a great rest of your day, everybody.